Welcome back to the academy. Welcome back. So, firstly, we give God Almighty all the praise. We give Him all the praise. He deserves to be praised. So, today we are going to discuss on an important topic that comes out in the exam, in your upcoming exams, which are what? It comes out in Viva and also in OSCE, Oxygen Administration. So, we'll quickly dive into the lectures. Now, I want you all to write. I believe you have subscribed so that when we go live, you will get notified. Even without the link being shared to you, you will get notified. So if you've not subscribed, make sure you subscribe and turn on the notification bell. Now, we'll discuss on oxygen administration. Now, oxygen therapy is the administration of oxygen to maintain adequate tissue oxygenation in patients with respiratory compromise. So, this oxygen is being given to a patient that cannot breathe on his own. There is respiratory compromise. That is why oxygen therapy is advised we give to a patient that is having respiratory compromise. Now, an oxygen cylinder is a metal container that contains and stores oxygen for medical use. Question: I want you to answer these questions in the comment section because you must pass your exams. Number one, the device that opens and closes oxygen flow is the A, the flow meter, B, the valve, C, the regulator, D, the gauge. What is the answer? Please send your answers in the live comment. The device that closes and opens oxygen flow is the A, flow meter, B, the valve, C, the regulator, D, the gauge. Make sure you make an attempt. Make sure you make an attempt. Okay, someone said valve. Onyinye, I'm impressed. Valve. All right, I will give you the answers after the class. So someone said the valve. Number two, the oxygen humidifier contains what? A, tap water, B, sterile water, C, alcohol, D, saline water. So the humidifier contains what? A, tap water, B, sterile water, C, alcohol, D, saline water. What is the answer? Tap water, sterile water, alcohol, saline only. So what is the answer? A humidifier contains what? I want to see your active participation. Okay, I'm impressed. Let's go to number three. The safest position for a patient on oxygen therapy is A, prone position, B, supine flat, C, semi-fowlers, D, Treadledenburg. Okay, I'm seeing your answers. I'm impressed. I'm impressed. Number four, the device used to control oxygen flow rate is A, the regulator, B, the flow meter, C, the pressure gauge. The device used to control oxygen flow rate is A, regulator, B, flow meter, C, pressure gauge, and D, valve. All right, I'm impressed. Finally, number five, before we dive into the lecture, someone saying supine. Okay, all right. So, number five, a normal oxygen flow rate for adults via nasal cannula is A, 10 to 15 liter per minute, B, 2 to 5 liter per minute, and C, 1 to 2 liter per minute. The normal oxygen flow rate for adults via nasal cannula is A, 10 to 15 liter per minute, B, 2 to 5 liter per minute, C, 1 to 2 liter per minute. Now you are going to send your answers to me on WhatsApp. You will send your answers to me after the class. then you will do your corrections, if any. Now let's dive into the lectures. Now, this comes out in exam a lot, and many students fidget, and they do give it to students for Viva. That is why we need to learn it very well. So this is the oxygen cylinder. Don't forget it. We have the key. We have the key. And the key is called the spanner. We have the key. We have this cylinder valve. This is just like a padlock and a key. This cylinder valve is the padlock. Don't forget, Nose Brainy showed you this black object on top of this oxygen cylinder. Nose Brainy called it the padlock, and the spanner is the key. Are we together? In case you are being given this for your Viva, this is the key. This is the padlock, the cylinder valve. So whenever you see valve, it is the word, the padlock to on and off this oxygen cylinder. It determines if there will be any flow out of this oxygen cylinder. And we can unlock this padlock, this black padlock, using the cylinder key or the spanner. So many student nurses, when they go to the hospital, they don't know how to use this. They don't know how to identify it. But for being in this academy, you will know how to identify it by God's grace. So, like I said, this cylinder valve, whenever you see the word valve, note it is the on and off of an oxygen cylinder. Then there is always a spanner. The spanner is the key that will either turn this to on it or turn it to off it. So the spanner is the key, the valve is the padlock. Are we together? Now, okay, before explanation, let us read so that you can write. So we have the cylinder, that is this. It stores oxygen under high pressure. It stores oxygen. You can just note it. It stores oxygen. The cylinder stores oxygen. The valve, it controls the release of oxygen. Please, are we together? Notify me in the comment section so I can know if you are following me. Can you hear me? I believe you can hear me. Notify me if you are following. Like I said earlier, if you've not, many of you have not subscribed, make sure you do so you get notified when we come online if there are network glitches. Now, we have the cylinder valve. Whenever you hear the word the valve, it controls the release of oxygen. That black padlock key I showed you initially. So, acts as the off and on switch, opened using a cylinder key known as the what? The spanner. Number 3, the cylinder key, which is the spanner, used to open and close the valve. Number 4, the regulator. The regulator reduces high pressure. From the word regulator, it reduces the high pressure. The regulator reduces the high pressure in order to give the patient safe, usable pressure. This helps to what? Prevent injuries and equipment damage. So that is the work of the regulator. That is the work of the regulator. Then the pressure gauge. The pressure gauge shows the amount of oxygen remaining. The pressure gauge shows the amount of oxygen remaining. That is the pressure gauge. The pressure gauge indicates if the cylinder is full or empty. The pressure gauge. Number 6, we have the flow meter. It controls the flow rate and it is measured liter per minute. The flow meter, it controls the what? the flow rate. It is measured in liter per minute. So it determines how much oxygen the patient will receive. The next, number 7, is the humidifying cup or bottle. It contains sterile or distilled water. Now, when you go to the hospital, they just add any tap water anyhow. But for normal standard hospital, that is why there is an addendum in your curriculum called quality improvement. We don't use tap water, we don't use pure water, we don't use anyhow water. What we use for dehumidifier is what? Sterile water or distilled water. And the essence of this is to what? To prevent dry air. Which can cause what? Barotrauma to the lungs or injury to the nostrils. So these or stronger airs. So this humidifier, it humidifies. What is the short term for humidifying? It moistens it, makes it more easier to flow and less dry, more soft, to prevent nasal damage or trauma. The next is the what? The oxygen tubing. It connects oxygen source to the patient. Number 9, we have the oxygen delivery devices. We have the nasal prongs, that's the cannula, we have the face mask, and we have the O-ring, which helps to prevent leakage of air, of oxygen. This is the face mask. This is the face mask. This is the nasal prongs. This is or called the cannula. Now, wonderful nurses and midwives, I want you to be fast. I want you to articulate fast with me. Are we together? Articulate fast with me. Now, for being in this academy today, whenever you see this in the hospital that has 2 little pipe connected to the nostrils of a patient, for being in this academy and you are for you being a different student, well trained in this academy, Nurse Brain Academy, what are you going to call this? Are you just going to call it oxygen tube? Or what? What will be the right answer for this when you see it connected to the patient? It is called the nasal prongs or the cannulas. Are we together? This is called the face mask. There are some patients that need this one. There are some patients that need this one. So depending on the patient's condition, we will know which to use for the patient. Now, this is the humidifying bottle. And what we put inside